My name is Alana Kapelak, and I'm going to talk to you about Hansen's disease. Hansen's disease, also known as leprosy, can appear horrific and reminiscent of horror stories or urban legends, when in reality, if diagnosed early enough and treatment has begun quickly, it can be easily managed and controlled. Once the infected person has begun their medication, as the doctor orders, they are no longer infectious. Luckily, Hansen's disease is still not very common in the United States, as we report only around 150 cases a year, while the rest of the world sees 250,000 cases per year. Who is most susceptible to Hansen's disease? Well, 95% of people have a natural immunity, actually. That definitely helps drastically slow the spread of the disease. Speaking of slow, it is so slow that it's rare and hard to study because of how slow moving the disease is. That very little is actually known about leprosy, especially regarding transmission, how it transfers to others from the infected. The most recent thought on transmission is that an infected person will cough or sneeze, and those droplets will infect another person close by in the mucosal tissue if make contact with their mucosal tissue. But those most susceptible would be someone who has spent close contact over a long period of time with an infected person, or someone from either Africa, Asia, South America. Will really select countries on those continents specifically. I do not believe anyone in our clinic to be at high risk for transmission, unless someone specifically spending lots of time in a close space with an infected person, which we should all be aware of now. Leprosy, or Mycobacterium leprae, is an acid fast rod shaped bacillus and multiplies very slowly, as I was saying, taking up to 13 days to divide cells. The agent is an obligate intracellular pathogen that is missing several genes, meaning it can't survive outside of the body in bacteriologic media. So it is mainly studied in the foot pads of mice, or surprisingly, armadillos. In the southern United States, many armadillos are carriers of Hansen's disease, and they have become the animal of choice for research. However, in this country, Hansen's disease is still so rarely occurring that it makes it difficult to study. The first sign of leprosy is usually patches of skin looking either lighter or darker than the surrounding skin. Oftentimes, they lose feeling in these patches. They can also present with growths or nodules on the skin, thick, stiff, or dry skin, as well as painless ulcers on the bottoms of their feet. Oftentimes, loss of eyelashes and eyebrows occurs as well. The nerve damage possible can lead to blindness. Testing for Hansen's disease is usually done with a skin biopsy from either the infected area or the knees, elbows, or earlobes, as well as they will do a nerve biopsy from any infected nerves. Typically, a person in the United States would make a visit with their doctor and go from there. Being such a slowly progressing bacteria, there is not a sense of urgency with getting diagnosed. We definitely would want to get on that as soon as possible. Treatment being multi-drug therapy, a combination of up to 3 strong antibiotics will be given for up to 1 to 2 years even. Once on antibiotics, the infected person is no longer contagious. Hansen's disease is important to us because left untreated, there are horrible, horrible complications the infected person deals with, as well as being contagious without exact certainty about the manner in which one gets infected. We definitely don't want the disease to spread. Being made aware of some of the signs and symptoms will help, but unlike many other diseases we will come across, there are still a lot of unknowns. Staff should be aware of what the signs and symptoms look like on a patient and use proper personal protection equipment such as gloves, face masks, and droplet gowns. And as always, frequent, thorough hand washing is of utmost importance.